Good morning. My name is Lindsay Olson-Mack. I'm a neurology nurse practitioner and stroke program coordinator at Scripps Health in San Diego. I am also the current chair of the San Diego County Stroke Consortium and have served in this role for the last 8 years. Today I'll be talking about transitioning from a primary to a comprehensive stroke center, what you need to know. I have no relevant financial relationships to disclose. So you've received word that you've been tasked with taking your hospital from a primary stroke center to a comprehensive stroke center. Although you've been given the green light to proceed, the road to become a CSC may seem daunting, but it doesn't have to be. There are tools and resources at our disposal to help navigate this journey. Conveying all the details needed to become a CSC in 10 minutes is a challenge, even with a person that speaks as quickly as me. Therefore, this talk aims to provide key tips on identifying important things a hospital needs to know related to eligibility and standard requirements in preparing for transition from PSC to CSC. As there are more than one certifying body that provides CSC certifications, please note that the information in this talk has been generalized. Hospitals seeking CSC certification will find additional information on the websites of the certifying agencies. Ultimately, an organization needs to understand what is required to achieve the desired state. In this case, we're talking about CSC certification and how that compares to the current state. It's important to note that even the most robust PSCs will find themselves with gaps. Even if the PSC is used to caring for a variety of complex stroke patients, they will likely find themselves needing to restructure some components of their program in order to become a CSC. Keep this in mind as we go along. Let's start with need to know number 1. All centers wishing to progress from a PSC to a CSC must have a clear understanding of the clinical practice guidelines. Your center, including those that are building your program, must maintain a strong understanding of the latest evidence-based care. It's important to note that clinical practice guidelines provide this information. However, they are released every few years. Thus, centers must also keep up to date on any recent statements and other documents that help interpret the standards. Moving on to need to know number 2. A center must know the minimum eligibility requirements. Understanding where your hospital aligns with these should also be a top priority for your organization. Volume eligibility requirements vary slightly from one certifying body to the next, and some have been revised as a response to the COVID-19 pandemic, but each have a minimum number that they require hospitals to meet to be eligible for CSC certification. All must provide care for a minimum number of patients with aneurysmal subarachnoid hemorrhage, perform a certain number of aneurysm coilings and clippings, administer IV alteplase to a minimum number of patients per year, and perform a certain number of thrombectomies initially, and maintain annual volume per provider. Advanced imaging modalities are required to care for complex stroke patients, and a hospital must have all of these in order to be considered for CSC certification. A center must also engage in clinical research in order to be eligible for CSC certification. Research must be IRB approved and should be focused on clinical patient studies. Establishing a research department focused on clinical patient studies for stroke can be difficult for some organizations. It often requires multiple areas working together to achieve a common goal, adding personnel and resources, all of which require administrative support and financial backing. Next, we move on to need to know number 3. A center will need to have a firm understanding of the CSC standards to identify gaps and plan for certification. CSC standards are shaped by clinical practice guidelines and provide the rationale for each standard. Although there are many certification standards to know, we will highlight a few key standards next. These are related to personnel, stroke unit, and neuro ICU development, protocols, and education requirements. Let's start with the Csc Medical Director. As a PSC, the requirement of a stroke medical director is someone who maintains sufficient knowledge of cerebrovascular disease. The Csc Medical Director, however, is required to have extensive expertise in neurology, the ability to provide clinical and administrative guidance to the program, and must be available as needed 24/7. Additional specialty coverage is required 24/7, 365, as well as documented evidence to support this coverage. This includes the emergency department, neurology, neurosurgery, neurointervention, and neuro-ICU coverage. In addition to the 24/7 availability of neurosurgery and neurointervention, a CSC must demonstrate the ability to care for multiple complex stroke patients at the same time. There are various ways to achieve this and will be very specific to the organization. From my experience, this can also be a challenging requirement for some centers to fulfill, as it requires a multifaceted approach and may take time to achieve. The requirements for stroke unit vary between a PSC and a CSC as well. As a PSC, we're required to have a stroke unit or designated beds for stroke patients. A CSC is also required to have a stroke unit, but in addition, a CSC must have a neuro-ICU or designated ICU beds 24/7 for the care of the complex stroke patient. Stroke education requirements increase with CSC certification as well. In preparation to become a CSC, a hospital should know the types of staff that require annual stroke education and the number of hours required for each department. This will require additional resources and have a financial impact to your organization. Moving on to need to know number 4. Your organization will need to know the additional quality metrics required to be tracked and trended when a hospital transitions from a PSC to a CSC. As a primary stroke center, your organization is used to tracking the STK measures, and one additional CSTK measure is listed here. If you're a center that transfers patients out, you will also be familiar with tracking some STK outpatient measures. The majority of the PSC measures are focused on the care provided to ischemic stroke patients, with only a few applicable to hemorrhagic stroke patients. As a CSC, your organization will be expected to track additional measures. The measures listed here focus on treatment and care provided to the hemorrhagic stroke patient. In addition, CSCs are required to track hemorrhagic transformation not only for post-alteplase patients, but also for patients undergoing mechanical endovascular procedures such as thrombectomy. CSTK 8, 9, 11, and 12 focus on the care provided for patients undergoing mechanical endovascular procedures. CSCs are also required to follow up on the most complex stroke patients and obtain modified Rankin scores as a measure of functional outcome. And this brings us to need to know number 5, know your gaps. Once you firmly understand the requirements needed to obtain CSC certification, you'll need to conduct a gap analysis. Similar to the method that certification standards are sorted, you'll likely find that your gaps will fall into one of 3 categories: structural, process, and outcome. These will impact your program on different levels. Do you need to revise a process already in place, or will you need to build a brand new process that may require more resources? Do you need to obtain equipment to meet eligibility? That would fall under structural gaps and may be quite costly. Outcome gaps, on the other hand, will take time to close, and progress will be seen long into your journey as a CSC. Once you've established your gaps, these need to be prioritized, with gaps in performing to the minimum requirements being at the top of the list. It's important to establish a realistic timeline to ensure survey readiness. In order to do this, tasks should be assigned and accountability created for closing gaps specific to your organization. But before you know it, you'll be on the exciting journey towards CSC certification. Here are my references. And thank you for attending my talk today. If you have any questions, please feel free to reach out at the email listed here. Thank you, and I hope you enjoy the rest of your day.